9 early signs of dementia that are often overlooked and 13 common symptoms of dementia, senior health. Have you noticed small signs of forgetfulness or confusion lately? What if these are the early warning signs of dementia and you've been ignoring them? It's not just aging. These signs can change your life. Knowing them could help you protect your mind. Don't wait for the inevitable. Let's discover what your memory, your brain, and your body are telling you before it's too late. There are 13 well-known symptoms of dementia and 9 early signs that many individuals may not recognize. It's important to understand that memory loss may sometimes suggest a condition that. Have you ever considered if dementia can be prevented? How might one recognize the early signs of this challenging condition? Today, we will take the time to carefully look into these important concerns. Many individuals around the globe are affected by dementia, yet there remains a common belief that it is simply a natural part of getting older. Shall we get started, my dear friends? Dementia is a term used to describe a range of symptoms associated with a decline in memory, reasoning, and other cognitive functions. It can affect daily life and may be caused by various underlying conditions. Dementia is a collection of symptoms that can affect cognitive abilities, including memory, language, thinking, and behavior. This condition can affect your ability to perform daily activities and may result from injury or the loss of nerve cells in the brain. Dementia refers to a broad category of significant cognitive decline rather than pinpointing a particular disease. Dementia is not a normal part of getting older, even though it is more commonly seen in older individuals. This condition necessitates a precise diagnosis and attentive care. I kindly encourage you to take a moment to open your phones and search for my channel. Dear friends, I kindly encourage you to take a moment to watch this video. Your subscriptions and comments would be greatly appreciated, as they help us foster a supportive community focused on health and well-being. It is important for us to clarify any misconceptions. It's important to understand that normal aging does not equate to dementia. It's important to emphasize that dementia should not be considered a typical part of the aging process. Most older individuals do not experience dementia, but it is important to recognize that the risk tends to rise as one ages. It is quite common for individuals to experience mild cognitive changes as they age, including occasional forgetfulness. On the other hand, dementia involves a significant decline that affects daily activities. It is important to understand that confusion or memory loss in older individuals is not always a typical occurrence. If you have ongoing concerns, it's important to consult with a healthcare professional for an accurate diagnosis. It's important to be aware of the 4 types of dementia that you should familiarize yourself with. Alzheimer's disease is the most common among the 4 types of dementia. Common signs include memory loss, difficulty with speech, and noticeable changes in behavior. Vascular dementia is a distinct type that arises from brain damage caused by circulation problems, such as strokes, and exhibiting symptoms similar to Parkinson's disease are all characteristic features of Lewy body dementia. Frontotemporal dementia primarily impacts language, behavior, and personality. Understanding the different types is important for determining the most appropriate treatment approach. There are 9 early signs of dementia that may go unnoticed. 1. Is having some difficulty with speech. It's possible that you may not fully appreciate it. Experiencing difficulty in finding the appropriate words during conversations can be an early sign of dementia. It is possible that the person may hesitate, using unclear language or selecting less appropriate options. While occasional slip-ups can happen, it's important to recognize when this issue becomes more frequent and begins to interfere with communication. It's possible that they may experience difficulty in naming common objects or phrases related to switching. Initially, you might not notice this indication, but it tends to worsen over time. It is important to remain vigilant regarding this ongoing challenge for early diagnosis. The census experienced 2 important modifications, including hearing and vision, among others. It's important to be aware that early signs of dementia can manifest as changes in vision, hearing, smell, and taste. Taking note of these changes can be beneficial for your overall well-being. It is possible for the individual to experience difficulties in judging depth and distance, as well as recognizing familiar faces. It's not uncommon to experience hearing difficulties, particularly when trying to engage in conversations in bustling environments. It is important to be aware of potential indicators, such as changes in taste and scent, which may lead to a reduced interest in things that were once cherished. These changes in your senses could affect your quality of life and may indicate some underlying cognitive issues. 3 dots may not provide the motivation needed to follow your passions. Please take care of yourself. One early sign that may suggest the onset of dementia is a noticeable decrease in motivation or initiative. It's not uncommon for someone to find themselves less enthusiastic about beginning new projects or engaging in activities they once enjoyed. They may appear to be disinterested, lacking enthusiasm, or showing a decrease in energy. It's important to remember that long-standing interests and pastimes should not be overlooked. A diminished interest in family gatherings or social interactions may indicate a decrease in motivation. This gradual shift in behavior may be misinterpreted as signs of depression. It appears that there may be a connection between the brain and muscular weakness. In certain situations, such as with Lewy body dementia and vascular dementia, you may notice that difficulties with muscle strength can serve as an early sign of dementia. It is possible for the individual to show signs of fatigue, experience muscle weakness, or have difficulty with precise movements. Even simple tasks such as using utensils or buttoning a blouse can sometimes present challenges. It is not uncommon to experience frequent falls or difficulties with balance as one ages. It is important to consider that these motor issues could suggest a need for further medical investigation, as they might arise prior to or in conjunction with cognitive decline. In familiar locations, 5 dots have become misplaced. In the early stages of dementia, it is quite common for individuals to experience spatial disorientation. It is not uncommon for individuals to experience difficulties in following basic directions, or to feel a bit disoriented in places they usually know well, like their own neighborhood. When trying to find their way around familiar places or locate a specific spot at home, it is possible for them to feel a bit disoriented. It can affect your ability to navigate and understand your surroundings. It is important to recognize that anxiety and frustration stemming from confusion can affect one's ability to maintain independence. There are 6 sleep issues that may provide valuable insights into your overall well-being. Changes in your sleep patterns could be an early sign of dementia. It is not uncommon for individuals to experience changes in their sleep patterns, such as difficulty falling asleep, waking up multiple times during the night, or feeling excessively sleepy during the day. Sundowning, which involves a shift in the sleep-wake cycle, may occur and can lead to increased agitation and disorientation. These sleep abnormalities may affect your overall well-being and can also create challenges for those who care for you. Addressing sleep issues is a vital part of managing dementia effectively. 7 is slightly hunched over. Concerns regarding posture and difficulties with walking. In certain instances, such as with vascular dementia and Lewy body dementia, you may notice that postural abnormalities can serve as an early sign of dementia. You might notice some stiffness in your muscles, a slight stoop in your posture, or perhaps some difficulty with movement. It is common for individuals to begin moving at a slower pace, perhaps with some hesitation or taking smaller steps. Changes in posture may affect your ability to move and could increase the likelihood of falls. While they may begin as minor issues, it's common for them to progress over time. A consultation with a physical therapist can be very helpful in identifying and managing these changes effectively. Simple 8-dot assignments may become increasingly complex. One of the most common early signs of dementia is experiencing challenges with daily tasks. Everyday activities such as using household appliances, managing bills, or cooking a simple meal may start to feel challenging. It is possible for a person to feel confused by certain processes, or find it challenging to perform tasks that once came naturally to them. This challenge may lead to some mistakes, feelings of annoyance, and a sense of lost freedom. To ensure an early diagnosis and appropriate support, it is important to keep an eye on any changes in your ability to carry out daily activities. 9. Seems to prefer silence at this time. Anhedonia, often referred to as apathy, can be an early sign of dementia that is important to recognize. It is not uncommon for a person to lose interest in activities they once found enjoyable, including social interactions and hobbies that brought them joy. They may appear to lack enthusiasm, motivation, and emotional connection. It's important to understand that while depression and apathy can appear similar, dementia usually does not present with the same deep sense of sadness. It is important to recognize that this disengagement can lead to a decline in both relationships and overall quality of life. It is important to recognize and address apathy as a significant part of dementia care. It is important to recognize the 13 key signs of dementia that you should be aware of. It seems you may be experiencing a significant sense of confusion regarding your surroundings and the passage of time. One of the well-known indicators of dementia is disorientation. It is possible for a person to feel a bit confused and may not accurately perceive the time of day or the current season. It is not uncommon for individuals to experience difficulties when trying to navigate back home or to places they know well. It's important to recognize that disorientation can happen regarding both space and time. This may result in feelings of confusion and anxiety, as well as an increased risk of encountering difficult situations. To help with disorientation, it can be beneficial to use techniques such as calendars, labels, and establishing routines. Planning and problem-solving can present some challenges. Challenges with planning and problem-solving can often indicate the presence of dementia. It can be challenging for some individuals to handle their finances, work with numbers, or adhere to a plan. Engaging in complex tasks such as planning an event or organizing travel can indeed present significant challenges. It seems that reasoning and problem-solving skills may not be functioning at their best. It is important to be aware that this may lead to errors, feelings of frustration, and a sense of diminished freedom. It may be beneficial to simplify tasks and provide support as needed. 3. Misplacing items. One common indication of dementia is when individuals place objects in locations that may seem unusual or inappropriate. It is quite common for individuals to place items in unusual spots and later have difficulty recalling their whereabouts. It is not uncommon to find food in drawers, clothing in the garbage, or even keys in the refrigerator. This behavior may lead to feelings of confusion and annoyance, as well as potential theft charges. It's important to focus on avoiding conflict, cultivating effective organizational strategies, and practicing patience. It may be helpful to set aside specific places for important items. For significant changes in behavior or emotions, it is quite common to observe changes in behavior or mood as potential indicators of dementia. It is not uncommon for individuals to experience sudden shifts in their mood, moving from a state of calmness to feelings of irritation or sadness without any clear cause. Behaviors such as aggression or sexual disinhibition can be considered inappropriate and should be addressed with care. It's not uncommon to experience social disengagement and feelings of apathy as we age. Changes can indeed affect relationships, and this can be quite challenging for those who are providing care. It's essential to understand that these behaviors are not intentional. They are indications of dementia. Utilizing techniques for behavioral management and communication can be quite helpful. Incontinence related to fecal or urine can be a challenging issue to manage. Experiencing incontinence of urine or feces can sometimes suggest a progression in dementia symptoms. It is possible for a person to have difficulty recognizing when it is time to use the restroom or to reach it promptly. It is important to be aware that sphincter control may be at risk. It's important to be aware that this situation may result in caregiver stress, concerns about hygiene, and feelings of shame. Consider using incontinence products, opting for easily accessible clothing, and setting up frequent reminders as helpful strategies to manage this delicate issue. 6 instances of visual disturbances involving dots. It's important to be aware that symptoms of dementia, especially in the case of Lewy body dementia, can sometimes involve experiencing hallucinations. It is indeed possible for individuals to experience perceptions, sounds, or sensations that may not have a basis in reality. It is quite common for individuals to experience visual hallucinations, which may involve seeing people, animals, or objects that aren't actually present. They may seem quite alarming and striking. It is important to be aware that some individuals may experience auditory hallucinations, which can include hearing voices. It's important to recognize the individual's feelings while not focusing on the reality of the hallucination. It may be beneficial to consider medication and redirection techniques. Concerns regarding short-term memory with 7 indicators. Short-term memory challenges can often be a characteristic associated with dementia. It is possible for a person to become a bit forgetful about recent events, conversations, or appointments. It is not uncommon for individuals to ask the same questions or recount the same story repeatedly, often without being aware that they have already discussed it before. It is quite common for past events to remain in long-term memory for some time. Experiencing memory loss can lead to feelings of confusion, frustration, and a greater reliance on those around you. Utilizing life stories, pictures, and textual reminders can be quite helpful. Social isolation can be quite concerning. One of the most common indicators of dementia is social isolation. It is possible for a person to lose interest in social activities and choose to stay home instead of participating in the things they once enjoyed. It's understandable that cognitive and communication challenges can lead to feelings of unease in social situations. It's important to recognize that isolation can be worsened by the stigma and lack of understanding related to dementia. This withdrawal may accelerate cognitive decline and affect your overall quality of life. Engaging in support groups and adapting activities can be quite beneficial. Inappropriate behavior can be represented by 9 dots. One of the possible indicators of dementia is engaging in behavior that may seem inappropriate. Sometimes, individuals may exhibit behaviors that seem inappropriate in public settings, such as talking or acting in ways that may not be suitable for the situation. It is important to be mindful of engaging in behaviors that may be considered inappropriate, such as exhibitionism or making advances that could be uncomfortable for others. It is not uncommon to encounter aggression, whether in words or actions, especially when focusing on self-care. For caregivers, these tasks may prove to be quite challenging and uncomfortable. It's important to remember that these are indications of the condition, not intentional actions. It can be quite helpful to consider environmental changes, gentle communication techniques, and redirection methods. There seems to be a question that involves a repeated 0 dot. A frequent indication of dementia is the repetition of questions. It is quite common for someone to seek clarification and ask the same question again shortly after receiving an answer. The difficulties you are experiencing with short-term memory and the retention of new information are the underlying reasons for this situation. For those who provide care, the constant repetition can indeed be quite tiring and distressing. It's important to respond with calmness and patience, using clear and simple language. It may be beneficial to consider using visual or written reminders. 1 dot is having some difficulty following the discussions. A common indication of dementia is experiencing challenges in keeping up with conversations. It may be challenging for the individual to engage in conversations, especially in noisy environments or among large groups of people. It is possible for them to become a bit sidetracked during discussions, have difficulty locating the appropriate words, or find it challenging to express their thoughts clearly. It's important to recognize that this can lead to misunderstandings, feelings of annoyance, and a sense of social disengagement. It is important to speak slowly and clearly, using short phrases, and to give the person ample time to understand the information. Minimizing background noise and other distractions can indeed be quite helpful. Time awareness can diminish with just a single moment. A common indication of dementia is a diminished sense of time awareness. It is possible for someone to confuse the current year, month, or day. It is possible that they may experience difficulties in remembering important dates, like appointments or birthdays. When an individual perceives that recent events happened a long time ago, or the other way around, it can create a sense of confusion regarding the passage of time. This temporal disorientation may lead to confusion and disrupt your daily activities. Maintaining a sense of time can be achieved through the use of clocks, calendars, and structured daily routines. Making decisions with a three-dot approach can be quite challenging. A common indication of dementia is experiencing challenges with decision. It may be challenging for an individual to evaluate options, weigh the pros and cons, or come to a conclusion. Sometimes even simple choices, such as what to eat or where, can feel quite challenging. More complex decisions, particularly those related to finances or health, may be at risk. This situation might lead to feelings of uncertainty, nervousness, and a reliance on others for support. It can be quite helpful to offer a few clear choices and allow ample time for making a decision. Understanding the factors that contribute to dementia. Dementia can arise from various health conditions, with Alzheimer's disease being the most common among them. In Alzheimer's disease, the accumulation of abnormal proteins in the brain can lead to the death of nerve cells. Circulation issues, like strokes, can lead to brain damage, which may result in vascular dementia. There are additional conditions to consider, such as frontal temporal dementia, which impacts the frontal and temporal lobes of the brain, and Lewy body dementia, characterized by the accumulation of the protein alpha-synuclein. It's important to be aware that an unhealthy lifestyle, cardiovascular illnesses, family history, and advanced age can all contribute to certain health risks. Preventing dementia. Managing diabetes can be as simple as monitoring a single dot. One important step in maintaining cognitive health is to manage diabetes effectively. Increased blood sugar levels may affect your brain function and can be detrimental to your blood vessels. To help reduce the risk of dementia, it's important to keep your blood sugar levels within the recommended ranges. This can be achieved through a balanced diet, regular physical activity, and taking medication if necessary. Managing diabetes can also enhance your heart health, which is an important consideration for maintaining cognitive function. 2. It's time to consider quitting smoking. One important way to help maintain cognitive health is to consider quitting smoking. It is important to be aware that smoking is associated with an increased risk of dementia, especially vascular dementia and cognitive impairment. Smoking can hinder the flow of blood and oxygen to the brain by causing harm to the blood vessels. Even in your later years, giving up smoking can enhance brain function. There are helpful resources available that can make the quitting process easier, such as behavioral support and nicotine replacement therapy. Stress can be effectively managed through 3 key points. One important approach to help prevent dementia is managing stress effectively. Long-term stress can have a negative impact on memory and cognitive function. To help manage stress, consider incorporating deep breathing exercises, meditation, and calming activities into your routine. It is important to nurture healthy social connections, engage in enjoyable hobbies, and find a balance between personal and professional responsibilities, as these elements greatly contribute to mental well-being. To help prevent cognitive decline, it is important to remember that caring for your emotional well-being is just as vital as looking after your physical health. Your mind is often engaged by 4 dots. Engaging your mind regularly can help you maintain cognitive health and may reduce the risk of dementia. Brain connections can be strengthened by mentally challenging activities like word games, puzzles, learning a new language, or playing an instrument. Intellectual conversations, writing, and reading are also helpful. By encouraging brain plasticity, these exercises maintain the brain's resilience and activity. For the optimum effects, it's critical to select engaging hobbies and change up the stimuli. Physical activity is 5 dots. It is crucial to engage in regular physical activity to prevent dementia. Because exercise increases blood circulation, the brain receives more oxygen and nutrients. Furthermore, exercise promotes the synthesis of growth factors that support the health of neurons. It is advised to engage in moderate aerobic exercise such as dance, swimming, or brisk walking for at least 150 minutes each week. Exercises for balance and strength are also helpful. For long-term adherence, finding engaging activities that fit each person's physical condition is essential. 6 dots continue to be socially engaged. Engaging in social interactions is an important strategy in the effort to combat dementia. Engaging in social interactions can greatly enhance your emotional well-being, stimulate your mind, and reduce the risk of isolation, which can contribute to cognitive decline. Engaging in group activities, such as volunteer work, art classes, or book clubs, can be quite beneficial. It's very important to nurture strong connections with your loved ones and friends. Maintaining long-term brain health can be greatly supported by staying socially active. Engaging with others provides valuable opportunities for communication, emotional support, and cognitive stimulation. Your sleep has shown improvement by 7 points. Improving the quality of your sleep is an important approach to help prevent dementia. Maintaining cognitive function, getting rid of brain pollutants, and consolidating memories all depend on getting enough sleep. Establishing a regular sleep schedule with consistent wake and sleep hours can be quite beneficial for your overall well-being. It can be quite beneficial to create a comfortable sleeping environment. Avoid screens in the moments leading up to bedtime, and practice some relaxation techniques. To achieve restorative sleep, it is important to address sleep issues such as apnea with care and attention. Weight loss can be accomplished with 8 dots. One approach to help reduce the risk of dementia is to consider weight loss if it is necessary for your health. As we reach middle age, it's important to be aware that obesity can be associated with an increased risk of dementia and cognitive impairment. Carrying excess weight may lead to issues with blood vessels, contribute to inflammation, and affect brain function. Achieving and maintaining a healthy weight is certainly possible through a balanced diet rich in fruits, vegetables, whole grains, and healthy fats, along with regular physical activity. Over time, making small, sustainable changes to your lifestyle tends to yield better results. The cognitive reserve associated with 9 dots. One approach to help prevent dementia is to enhance cognitive reserve. Cognitive reserve refers to the brain's ability to endure injury or illness while still maintaining its cognitive functions. This reserve is developed through a combination of factors, such as education, engaging in complex employment, and maintaining lifelong participation in mentally stimulating activities. A greater cognitive reserve in the brain can enhance its resilience in facing challenges. Maintaining an intellectually stimulating lifestyle, engaging in challenging hobbies, and pursuing ongoing education can be very beneficial for your well-being. Your diet has been enhanced by 10 point. One of the most beneficial steps you can take to help prevent dementia is to focus on enhancing your nutrition. A nutritious diet provides the essential nutrients needed for optimal brain function. Adopting a Mediterranean diet that includes plenty of fruits, vegetables, whole grains, fish, nuts, and olive oil may help reduce the risk of cognitive decline. It's important to be mindful of your intake of processed foods, added sugars, and saturated fats, including foods rich in antioxidants, such as berries and leafy green vegetables. along with omega-3 fatty acids found in walnuts and salmon, may be beneficial for your brain health. A single dot helps manage cholesterol and blood pressure levels. To help prevent dementia, it is important to manage your blood pressure and cholesterol levels effectively. It is important to be aware that elevated blood pressure and cholesterol levels can be associated with an increased risk of vascular dementia and cognitive decline. These elements may pose a risk to your blood vessels and can affect the delivery of oxygen and nutrients to the brain. Maintaining normal levels of blood pressure and cholesterol can be achieved through a nutritious diet, regular exercise, and effective stress management. In some circumstances, it may be necessary to consider medication, as advised by your physician. Recent improvements in the care of dementia. The research surrounding treatment options for dementia is continually evolving. While there is no treatment available at this time, recent research is focused on slowing the progression of the disease and improving quality of life. Researchers are exploring more effective medications to help manage behavioral and cognitive challenges. Engaging in cognitive stimulation, participating in occupational therapy, and enjoying modified social activities are wonderful examples of non-pharmacological therapies that can offer significant benefits. Advancements in early detection through biomarkers and imaging tests can facilitate timely interventions. Researchers are exploring innovative approaches, such as gene therapy and immunotherapy, in their quest to discover therapies that can modify diseases effectively. In summary, a more positive mental outlook awaits you. Many individuals around the globe are affected by dementia, which is a complex condition. It is important to be aware of the early warning signs, hallmark symptoms, and causes of dementia for timely recognition and diagnosis. While a cure is not available at this time, you can take steps to prevent the condition by maintaining a healthy lifestyle, managing risk factors, and participating in activities that stimulate your mind. Recent advancements in therapy, driven by continuous research, offer promising prospects for improving the quality of life for individuals living with dementia. Taking care of your brain health as you age is a thoughtful choice that can greatly benefit your cognitive well-being in the years to come. Please take a moment to consider signing up for the channel. It could be quite beneficial for you. I sincerely wish for your well-being, prosperity, and happiness. I look forward to seeing you in the next video.